On the internet, looking for information about healthy skin is like searching for buried treasure. If you suffer from acne, you must have seen endless tips on social media, including lifestyle guru tips, which seem to work for everyone except you. Somebody swears that by doing a 10-step skincare routine, their skin is great, while another person just slaps on 2 products and they're good to go. So if you want honest, science-backed answers related to acne, you come to the right place. I'm Dr. Divya Datta, and let's get started. Before we begin, here's a quick disclaimer. I'm a medical intern, not a board-certified dermatologist, so this video is only for educational purposes. Please consult a qualified physician for medical treatment. I've divided this skincare series into 3 parts. Part 1 is where I'll tell you what is acne, what causes acne, how you can treat and prevent acne by attacking the causes. Part 2 is a skincare routine for acne-prone skin or sensitive skin. And in Part 3, I'll be answering frequently asked questions you might have related to acne and skincare. So what is acne? Acne is a chronic inflammatory disorder of the sebaceous follicles. If you do not know what is a follicle, follicles are pores present on your skin. So to break down this definition, chronic means long-lasting. So that means this disorder is going to last for months to years. Inflammatory, which means that your immune system is reacting, so pimples will be red, swollen, or painful. And disorder, in which the pilosebaceous unit doesn't function properly. And now what is a pilosebaceous unit? It comprises of a hair follicle and oil gland. Acne is almost universal in adolescence, but it is more severe in males and improves with adulthood. Still, adult acne can be seen especially in women. Now, where does acne occur? On the skin, there are 3 types of follicles. The beard follicle, which comprises of thick hair and is not involved in acne. Then you have the vellus follicle, which comprises of fine hair and is rarely involved in acne. Then the 3rd type of follicle present in your skin is a sebaceous follicle. This comprises of a hair shaft, oil gland, and a small opening in the skin. If the sebaceous follicle is blocked, the immune system gets activated and acne develops. And so our question arises, what causes these follicles to get blocked? And the answer isn't that simple because acne is polygenic and multifactorial. There are many factors and genes responsible for acne, and this is not inherited like your eye color. And these causes can be due to hormonal changes such as increase in the levels of androgen in your body, or it can be due to bacterial infections by Cutibacterium acnes, or it can be due to exogenous reasons by using irritants like hydrocarbons and cosmetics and poor lifestyle habits. Now, how is acne formed? When you have high levels of a hormone called androgen in your body, this causes the increased production of oil or sebum in your skin. This is responsible for dead cells to block the follicles present in your skin. And this results in the formation of an invisible lesion called microcomedo. A microcomedo can either develop into an open comedo, which is known as blackhead, where the pores are dilated, or it can form a closed comedo, which are known as whiteheads, where the pores are clogged. This creates a suitable environment for a bacteria called Cutibacterium acnes. Now, this bacteria secretes enzymes and chemicals that can activate the immune system and cause acne lesions and inflammation. Now, there are 3 types of acne lesions. First are pustules, which are like small abscesses. Then we have papules and nodules, which are like painful red bumps. The most severe acne lesion is known as cyst, which is also known as acne conglobata. These acne lesions usually heal, but if they don't and rupture, it can lead to scarring. Now, there are various patterns of acne. In teenagers, acne is more common. The skin is more oily and the lesions seen are mostly pustules and comedons. In adults, acne is less common, but the lesions seen are nodular and can contain scars. In face acne, acne is seen on the cheeks, nose, and forehead. They mostly contain papular lesions. Then we have chest and back acne, which is seen in more severe acne, where the lesions are more nodular and there are more scars. So from all of this, we can see that the main driver for acne is hormonal imbalance, especially increased levels of androgens. And that is why patients with PCOS tend to have more acne, and older studies have also shown a link between thyroid enlargement and acne. So an effective way to treat acne is by controlling hormones, reducing microbial infection, treating and preventing inflammation. Now, to control your hormones, let's find out the biggest culprit for hormonal imbalance, and that is stress. Stress comes in many forms. When your brain senses any threat, it activates a stress response system, which triggers a flight and fight response. This causes an increase in the levels of adrenaline, noradrenaline, and cortisol, leading to hormonal imbalance. Now, stress can be caused due to external reasons such as peer pressure, exams, deadlines, relationship issues, or pollution. Internal stress can be caused due to puberty, menstrual changes, spikes in blood sugar levels. Now, the bad news is stress cannot be cured. The good news: managing stress starts with something you do every day, your lifestyle. So let's discuss about the biggest factor linked with stress, your diet. Research shows that a high glycemic index diet is linked with more acne. If you guys are new to my channel, I have made a video named PCOS 101 where I explain about glycemic index diets. A glycemic index is basically where food items are ranked based on how quickly they raise your blood sugar levels. So food items with a glycemic index less than 55 are safer for your skin, and food items with a glycemic index greater than 77 are less safe for your skin. Other than high glycemic index food items, other food items that can trigger your acne are cow's milk, whey protein supplements, soya products, processed meats with hormones, soda, refined sugars, and even gluten. Sometimes it's not just about what you eat. Simple mistakes such as skipping breakfast, not eating a nutrient-dense diet, drinking coffee on an empty stomach can also stress your body. Now I'm going to share a powerful way you can control your blood sugar levels throughout the day. Eat a protein-rich breakfast comprising of about 20 to 30 grams of protein. Now this can look like 2 to 3 boiled or scrambled eggs, grilled chicken with a salad, a protein smoothie with nuts, lentil soup, cottage cheese, and Greek yogurt. Basically, this will help you control your blood sugar levels throughout the day, reduce stress on your body, hence it balances your hormones. Now let's talk about basic factors that can help reduce stress on your body. First is hydration. Water doesn't cure acne, but if you're dehydrated, you stress your body out. So drink at least 7 to 8 glasses of water. Another non-negotiable is sleep. You need to sleep at least 7 to 8 hours every night to reset your body. And of course, exercise. Now, strength training is especially beneficial for women, but you can also do aerobic exercises such as running, jogging, cycling. This helps reduce stress on your body and control your hormones. All this information was about improving your physical health for reducing stress. Now let's go on to the mental factors for reducing stress. Beyond your physical health, give your mind a break too. Try digital detox where you cut down your screen time and social media. Spend more time with your family and loved ones. Try meditation or yoga. And if you need, join therapy for more support. You can't eliminate stress completely, but you can train your body to respond to situations calmly instead of being in a constant flight and fight mode. And that's the key to controlling hormones. Now, my YouTube channel has many health hacks and tips dedicated to reducing stress on the body, so if you're new, definitely check them out. Alongside lifestyle changes, certain supplements may help. There is strong evidence that omega-3 fatty acids and zinc help balance hormones. there is moderate evidence that magnesium, probiotics, vitamins A, D, E, and C help balance hormones. Herbal remedies such as ashwagandha look promising but don't have enough evidence. And one last note. Don't apply harsh chemicals on your skin. Toothpaste on your skin and other DIY hacks. Don't do it. It'll just add more stress to your skin. Now let's get to our second pillar of management, antimicrobial treatment. If you remember, I told you that when the skin produces excessive oil, it creates a perfect environment for a bacteria called Cutibacterium acnes, and for this, dermatologists prescribe various antibiotics. Antibiotics can be prescribed in two ways. Topical antibiotics are directly applied on the skin, and this can comprise of benzoyl peroxide and drugs such as clindamycin and erythromycin. But clindamycin and erythromycin are always prescribed with benzoyl peroxide to prevent resistance. Then we have oral antibiotics, which are given through tablets. This can comprise of tetracyclines for severe cases, which can comprise of drugs such as doxycycline and minocycline. Then we have macrolides, which comprise of azithromycin and erythromycin. But there is increasing resistance against macrolides. In some cases, a drug called trimethoprim sulfamethoxazole is prescribed. And a typical oral antibiotic course is about 3 to 6 months to avoid resistance. Now let's talk about acne's most famous medication, oral isotretinoin. This drug is not an antibiotic, but it shrinks the sebaceous follicles, reduces the production of oil. This starves the bacteria. And this drug is only prescribed in severe and resistant cases of acne. But this drug comes with its own strict precautions. It is not suitable for pregnancy because it is teratogenic. It can harm the fetus. It can also cause ear damage. This drug is never administered with oral tetracyclines because it can lead to a condition called pseudotumor cerebri, which is a serious condition. And before this drug is prescribed, usually a blood test is done, specifically a liver function test, to see if this drug is suitable for you. Other agents, such as blue light therapy, can kill bacteria, or natural products like tea tree oil are antimicrobial, but they're not as effective as medical treatments. So if you are prescribed antibiotics and oral isotretinoin, follow your physician's orders and do not overuse these drugs to prevent resistance. It usually takes about 6 to 8 months to see actual results, so do not give up hope soon. And now we've reached to the third pillar, that is to reduce or prevent inflammation, because acne is not just about the bacteria, it's also about inflammation. So to calm inflammation, doctors may prescribe retinoids such as adapalene available over the counter, tretinoin or tazarotene. Niacinamide may also be recommended, which is available over the counter. This helps repair the skin barrier and reduce inflammation. For women, oral contraceptives and spironolactone may be prescribed. And in severe cases, short-acting oral prednisone may be recommended. Other options to reduce inflammation are red light therapy to help soothe the skin, use of chemical peels such as salicylic acid, glycolic acid, and lactic acid, a diet rich in antioxidants such as green tea and berries, and simple home remedies such as cold compresses or hydrocolloid pimple patches may also help. So the key takeaway is that acne management comprises of controlling your hormones by antimicrobial treatment and by anti-inflammatory treatment to soothe the skin. This brings us to the end of my Part 1 skincare series. If you have any questions related to skincare, drop it in the comments. Thank you for sticking with me till the end of this video. Don't forget to like, share, and subscribe to my channel. Because in Part 2, I'll be sharing a skincare routine for acne-prone and sensitive skin. I wish you a marvelous day. Bye-bye.